Okay, good evening, everybody. Welcome back to another episode of Mondays with Moshe. This is Moshe Norman out of Lakewood, New Jersey, and I'm quite glad to resume our show after a very long hiatus. I think we're like probably 5 or 6 weeks. Thankfully, I got to take some vacation and spend some time out of the country, which was really, really nice. And I'm glad to see you all. For those of you who could turn on your video screens, of course, we love to have that. And of course, for those of you who want to pipe up and ask questions and say comments, we'll be really excited to take them. Tonight's topic is the process of psychedelics in psychotherapy, which is a really exciting topic. It's gaining a lot of traction, a lot of interest in the mental health field. And tonight's featured presenter is Dr. Binyomin Tepfer out of Brooklyn, New York, Lakewood, New Jersey. Anywhere else, Dr. Tepfer?
Cedarhurst, New York.
Cedarhurst, New York. Okay, so pretty much if you're in the New York, New Jersey area, Dr. Tepfer is available for a phone call, a consult, or you can even make it in person, unless you live in Lakewood, where you probably have to travel like 3 hours to get to him in Lakewood. But if you live in Cedarhurst, it's only a 2-hour drive from Lakewood. So Dr. Tepfer, really glad to have you on, and thank you for joining us again. This is time number 2, I think, or 3.
Yes, I think this is my second time. I had such a good time the first time. I was happy to join again.
Waiting with bated breath for another invite.
Yes.
Okay.
Yes.
Okay. Dr. Tepfer, just first tell us, how did you get into the world of psychedelics? How did, I know you're a psychologist, but last time we spoke, I never heard of the word psychedelics, probably, and certainly not as a treatment, a psychotherapeutic treatment. How did you get into this? Where did you find it, and what do you know about it?
That's a great question. I think it was 3 years ago. A friend of mine who actually is not in the field of mental health, he's a venture capitalist. He's always on the forefront of different investments. He says, Binyamin, you're a good friend. He said, there's this thing called psilocybin. It's up and coming in the investment world. I don't know much about it, but I just know that it seems to be something that's going to be a game changer in mental health. And I still remember exactly where I was, and I'll tell you why. I was looking around, and I got it was a session. It was a videoed session online. It was part of a documentary called Trip of Compassion, which you can watch, I think, on Vimeo. And it was research done at the University of Haifa, and they had permission to bring cameras into the session. It was an MDMA session. They were doing research on PTSD and MDMA, which we'll talk about as one of the medicines that are used. And we've all done therapy and trauma work, and we're all like, looking for that magical moment, which sometimes happens. There's this opening, and it's beautiful. It doesn't happen all the time and every day, not with every person. And Moshe, I watched what was going on in that session, and it just blew me away. And we all watch footage in different sessions, but what they were able to, the level, what they were able to access, the material, and how emotive, and we're talking about 6 to 8 hour session, long sessions. These are lengthy sessions, and just to watch the process happen. So that's where it started for me 3 years ago. And then I read, watched anything and everything I could until I finally was able to train in it firsthand, and start facilitating sessions the last year or two myself. So that's been my exposure to that field and my entry into it.
Wow. Okay, so you were really taken. You saw something, you were taken by it, and you pursued it.
Yeah.
Okay. Now, I'm looking at the list of participants, and there are some people on here who are clearly, from my knowledge, either diehard psychedelics or diehard interested in psychedelics, and then there's probably some individuals on here who know very little to nothing about psychedelics and what they are. So you talk about psilocybin, there's MDMA, there's ketamine, there's all kinds of names and words that mean nothing to some of us. Can you tell us, first of all, what is the idea of psychedelics? What does it have to do with psychotherapy? And maybe we can start talking about the different types and how to use them.
Sure, sure. So, well, psychedelic is actually, it's a recent term. Psyche is either the mind or soul, and delic is revealing, opening, revealing. There's a whole group of medicines, different types, that when taken, what they do is there's some form of, I'll call it revelation or opening, where the usual ego that controls the unconscious mind, filters everything, keeps things in usual patterns, is somehow laid to rest, quieted. And then in that state, ingesting these medicines, what ends up happening is the individual is able to somehow have a window or access ways of thinking, patterns of thinking, or parts of the mind that you don't usually get to. So like a way to, an example is, when we dream. So we sometimes know we're dreaming, we sometimes don't know, but we sort of access like a flow of the unconscious mind. And sometimes we remember it, and like we can put together why we did that type of thinking, and why we were playing with those type of images. And it's a similar state in under the influence of a psychedelic, where these medicines really allow a person to experience just observing and watching their mind. But it's hard to put into words from a very different state. We usually experience the world through the ego state. There's an I, and there's things that we look at, and under these medicines, sometimes that gets dissolved, and there's like a unity with self and the world. The self is experienced as one with the world. Sometimes you can see under these medicines yourself falling apart, and then experiencing oneness with memories, with experiences, with objects in the world. So it sounds a little bit bizarre, but the real question is not, okay, what's this state about, but why is this state useful, for therapy? And that's where things get really, really interesting in terms of the recent research that's come out in the last 20, well, really it's from the 50s and 60s, stopped because of the war on drugs, and then resurfaced again in the 80s, 90s, and the last 20 years, just the effects of doing therapy with clients or patients that are in this state and accessing, whether it's trauma, whether it's patterns of thinking, and using that therapeutically. That's really been the breakthrough in the last bunch of years.
Okay, so I have a bunch of questions. Maybe I'll throw them all at you at once because they're connected, and either we'll break them down or we'll slow them down. But one of the questions that's on my mind is there a difference between the treatment, using these drugs, or let's say wine or alcohol, which also seems to have a similar effect of uninhibiting a person? And the other question is, are we looking at this to uninhibit the person so that they can, like you said, the ego is typically sort of controlling or monitoring how much is going to come out. So our ego will say, okay, that's not good for you, that's going to embarrass you, that's going to hurt you, and it controls how we ebb and flow. Is this used to uninhibit the person, to let everything come out and spill out, or is it more used to access old memories, old thoughts, old patterns that one may have forgotten about, or everything?
Yeah. Okay. So quick question. Questions. So let's give the first sort of explanation, and I think it'll answer the question about alcohol and about things spilling out. The way that we generally think, if we study our thinking from yesterday, today, the day before, so research shows that like 95 or 96% 6% of our thinking is very similar one day to the next to the next. We have these like patterns in how we think, how we approach problems. And so it's good because it allows an overwhelming world to be filtered down to, how we think in categories and quickly label things and identify things and don't get overwhelmed, and also make very quick decisions all the time. So we've become very efficient. But the problem is, and we know this in mental health, is that efficiency comes with a price. And that price is if I have a pattern that I think of myself a certain way, or I approach problems in a dysfunctional way, or relationships, these patterns are there and they stay. What's fascinating is that under, let's say, psilocybin, they have fMRIs. What happens is there's a shutdown of the default mode network, which is really the ego. So the usual highways, the usual patterns, the default mode of what my brain goes to gets quieted. And when that gets lowered, what happens with the brain is that it has this ability, this very this opportunity, almost like a neuroplastic time frame, where it's able to go to everything like a fresh coat of snow. There's no grooves that the thing is going to go into. So the mind, it's really an inner healer type of approach, where the mind itself is going to create somehow new patterns, brand new, fresh associations with information that's floating in the unconscious under psychedelics. So what we'll see a whole new range of different connections happening. There's something called synesthesia that can happen, where sounds can have certain shapes to them, or shapes can have certain smells. Like we can cross over different senses when you're under psychedelics. So what this does is it just allows a person to have a fresh connection to mind, to thinking, to self-awareness, and to certain traumas. Now, what happens, wine, for example, does not do that in the same way. Alcohol, as a retardant, what it does is does a very different thing. It really narrows the person's focus and experience, rather than, it's not an expander, it's a downer. So, for example, if a person is in a certain setting, that setting is what wine will ultimately accentuate. So if a person's in a very small, lonely place, he'll be very, very sad and lonely. If a person's in a very loud, big party, then usually that's where he'll go. So it's just a very different neurological effect in terms of what it does. Now, under the psychedelics,
it sounds like
let me just finish one thought.
Yeah, go ahead.
So it's not that we sit there and the person is going to spill something out there uninhibited. A lot of times there'll be very, very long periods of time in a session where there's quiet, where the person's going in and the person is staying inside. But what I meant by the inner healer is, under the proper set and setting, which we'll talk about, how we actually set up a psychedelic assisted psychotherapy session, then that person is very likely going to be going back, because there's music playing, there's certain things that we set up as the session was beginning. The person is going to be going back in themselves to different images and memories. And like we said, without the default mode network, I can go back to certain traumas. The brain will go where it needs to go. We don't suggest or insist on anything. But when it goes back, it doesn't have the usual patterns of how I remember that trauma, of how I go back. And often that trauma can now be linked to a very, very different set of interpretations or of emotions. So then me coming now out of that, I can say, wow, during that trip, I went back to this space or this episode of this experience when I'm talking about that session, but I have a whole different feeling and association. I have a new experience revolving it that the mind itself went to. So it's not that I was uninhibited, but it was that there's an inner healer that takes place on its own, an innate healer.
It's almost, it sounds like an Etch-a-Sketch, where you draw you're kind of cleaning, you're wiping out and creating a clean slate in which you can create new neural pathways.
Exactly. Exactly.
Wow. And is there any risk in doing this that the opposite will happen, that somebody will go into re-traumatization and potentially, again, because their state is they're in a calmer state, in some way become re-traumatized in even more profound way?
Yeah, sure. So Well, like any any therapy, I think anything that we do, there's a level of risk, right? Even in psychotherapy, as we talk about traumas of the past and we don't do so carefully, right? Is there a risk of re-traumatization? Of course there is. But what we're seeing with research, if there's a proper, safe container for these therapy sessions, for the medicines, and it's done and safely and responsibly, then these are generally safe medicines. Most of them, if not all of them, can't even be overdosed. It depends on which medicines. They're generally not addictive. Psychedelics are not a category of medicines that become addictive in terms of like withdrawal symptoms. So they're generally a safe category of drugs when used responsibly, and people have to get a psychiatric evaluation prior just to make sure that they don't have certain cardiac issues. Can sometimes be an issue specifically relating to MDMA. If they have dissociative identity disorder, or if they have schizophrenia, or they're in a manic episode, ketamine won't be recommended. So there are certain exclusionary criteria, but aside for that, we're now in phase 3 of MDMA studies, where they're giving it to thousands of people, and they're really showing just very promising, good results in terms of the safety of these medicines. So,
Okay.
yeah.
Okay, let's start a little bit with ketamine, because I've had some exposure personally to ketamine.
Yeah.
There's a clinic here in Lakewood that opened recently. It's called REU, and they invited me to come down. The folks at the clinic, I think they might even be on the show right now. They invited me to come down and experiment, and get a sense of what it's like. And I was somewhat hesitant, but then I saw that masters like Dick Schwartz from IFS and other great, very responsible and mature, sophisticated therapists themselves talk about their experiences using ketamine or other psychedelics. And I said, if you can do it, I can do it. So I went down there and had a number of ketamine sessions. The experience was unreal, really not to be explained, very difficult to put in words. I connect very much with what Dick Schwartz said. Maybe I'll play that clip one day if I pull it up. He talks about feeling less afraid of death because he kind of experienced this out of body experience where you sort of feel like you're leaving this world. You're kind of conscious of it while feeling like you're leaving at the same time. The experience is really, really, really difficult to describe, but it really is out of this world in a literal sense. And I know that there's a difference between what we would consider, let's say, a ketamine infusion, which is a higher dose of ketamine, versus what they would call psychedelic assisted or ketamine assisted therapy, or things that you take home. Tell me about some of the differences between some of those kinds of treatments and
Yeah,
how ketamine is.
Sure. Yeah. So just a word, you mentioned someone like Dick Schwartz, and I want to throw in a few other names. There's Gabor Mate, there's Peter Levine, there's you have
did Gabor Mate actually take it? Did he try it?
Bessel van der Kolk. So all of the names I'm mentioning, which are really the leaders, I would say, in the field of trauma, without exception, every one of them are really big proponents of the use of psychedelics for PTSD specifically. Every one of them. When I was training at the Ketamine Training Center myself, this goes back last June. So in my cohort, Bessel van der Kolk was there training together. We spent a week up in Menlo, New York, where he was training to be able to assist in ketamine assisted psychotherapy.
And you couldn't get him to come on the show.
Well, you had to pay him enough, and he'll join. Or actually, I think you'll just tell him the following that you have, and he'll jump the wonderful audience that's here. But They're all so that's just you really have the leaders of the field very, very much not just backing it, but seeing the results. And I would say ketamine is the most popular because the truth is it's the only legal psychedelic right now that's out there for use. The reason it's legal is because the way we're able to use ketamine is used in emergency rooms, and paramedics use ketamine, and it's used as for non-responsive for depression, and where other medicines haven't been effective. And what we're able to do is, if we can justify off-label use for ketamine in psychedelic-assisted psychotherapy, that allows the usage of it legally. So any other psychedelic right now is technically illegal, and there's only there's an underground world exploring it. But either it's being done in research or it's ketamine, and ketamine itself is not your classic psychedelic. It's more of a dissociative type of medicine, where the effects of it are slightly different. I mean, ketamine is interesting because of the range. In smaller doses, it's more of a heart opening. I think in the higher doses, it becomes much more of a psychedelic. So there is range to it depending on the dosage of it. So it is pretty versatile in terms of a medicine. But yeah, there are others that do other things. Each of the medicines are different categories. So just to mention a few, there are the empathogens. For example, the medicine like MDMA, which is being used for PTSD, that's more of a heart-opening medicine. So that opens up very, very much empathy in people, and that's what's very effective for PTSD. You have psilocybin, which is much more of a hallucinogen. It's much more otherworldly, that it goes off into far places. And then there are other categories of entheogens that give an experience, very much God and divine type of experiences. So LSD can have that. And there's a lot of overlap, but there are different categories. Now, going back to ketamine in terms of how it's done. So we will give a dosage in the beginning of a session, very different than the IV that's being given in terms of depression, because there are a bunch of sessions that we're prepping the person in terms of their life story, in terms of what traumas they want to work on. So we're getting the mindset that this session is going to be about going inward and about a journey and about accessing what needs to be accessed. And then there'll be poetry, there'll a lot of times be pictures that the patient is going to bring in to create that type of set. And there'll be certain type of evocative and emotional music that's playing while the person's in that session. And the setting there has to be a container that holds that experience. So we'll usually have two therapists there at the same time, sometimes a male and a female therapist. So it's there to create a safe container. The person's sometimes in a compromised position. So for them to just ethically, legally, for there not to just be one therapist with that client. So we'll have usually two therapists there during that session. And yeah.
So are you talking about a ketamine infusion, or are you talking about psychedelic, ketamine assisted therapy?
Ketamine assisted psychotherapy. So in ketamine assisted psychotherapy, what we're looking for is a deep inner experience that is going to have parts where there's talking. The person can sometimes go in and then sometimes be quiet for 20, 30 minutes of the session, and then will take off their eye shades and then want to process or want to speak about what's coming up and what they just saw. Sometimes it's frightening for the person. They'll be going back to things and creating that safe container with both the therapists there, being able to encourage that person to stay with that. And then that when they stay with that and feel supported, it'll almost always open up into some sort of relief or solution. It's working through that trauma. There are beautiful moments. I'll give you an example to make it a little bit more concrete. I was doing a session with someone, ketamine session, and he was quiet for around 15, 20 minutes. And then He just took off his eye shades and wanted to share with me, and I leaned in, and he said, I just saw the most beautiful, beautiful imagery. He said, there was a woman, this was a friend of his, when he was a middle-aged man, he must have been in his 60s, who had passed away when he and she were much younger. This was 25 years before. And he said, and I was standing next to a stream, and I saw her face, and she was in the stream and she was flowing by. She was the stream. And she said, and then there was a tree, a fruit tree that was right next to the river. And he said, and I reached up and I picked off an apple off of the tree, and I handed it to her, and she smiled and she took it. And then she kept on going and moving in the stream. And there was this warm comfort that I felt for the first time in my life, knowing that I was at peace with saying goodbye to her and offering her that, and she was at peace receiving that from me. Now, what is that about? What's a river and an apple tree? That was just this symbolism for him of going back to that face and that experience and that grieving and mourning that was able to just be worked through. How and why, with the set and the setting of going back and going in. That's where his inner innate healing took him, and that was the imagery that was worked through. So now, forever that face has a certain. It's not just about loss, but there's a connection. There's comfort associated with that. Does that make sense?
Hmm.
So that's an example. Yeah.
Yeah. I also actually had the privilege of providing psychedelic ketamine assisted psychotherapy in one session to a resistant client who was actually resisting the ketamine infusions, complaining of a lot of physical nausea and sickness. And it was also an extremely profound and beautiful process where she was able to access old memories of her having surgery for the first time as a little girl, and really go through that process. And at the end of the surgery, she woke up and and said she was feeling very sick. And I said, can you remember what feeling you were experiencing? And she said it was extremely nauseous, and I wasn't expecting it, and I didn't think I'd come back to myself. It was a longer session, but she was able to put together the chronic nausea that she has today with that first earlier experience, and it was a tremendous breakthrough for her in the treatment. So it was really incredible.
Sure.
And she just kept saying, I never thought of that. I didn't remember the story, and I never thought to connect the two things.
Yeah. Sure. We've had a number of experiences similar to that. That's a very powerful example of that, of where you go back to these very repressed old memories, and if that default mode network is just not there, then the repressions aren't the same either, and things are just remembered and connected and associated in that way. So you can sort of get a deeper look at older traumas that connect to the trauma link, but then there's also connections sometimes with new associations that are strengthening, that are comforting, that are healing with that. So sometimes the trauma goes back and deeper, I think, and gets connected. So it can deepen the trauma in a certain way, but deepen, I think that's towards healing. And then there can also be resources that are pulled in those memories. I've seen that as well. So we had a case where we had a session where there was a girl who kept on just being in the room with her brother who had molested her, and she was just stuck in that room. It was it was 45 minutes or an hour. It was a very, very dark point in that ketamine session, and she was frightened and scared, and what's interesting, she kept on pendulating back to, she had a boyfriend who they had spent time at some place. It was a beautiful place in nature on the water where the boyfriend was, and she would then say, and now I'm back on the water with him, it was like, people who do like EMDR, or I'm sorry, more somatic
Mhm.
work, somatic experiencing work. And so you sort of, and then she was back, but I'm back in the room now, and my brother's banging on the door, and she would then pendulate back to the water, and so you saw her really going.
So she was able to access that resource, you mean,
Yeah,
and
yeah,
integrate
and
with it.
integrate. There was integration going on. So it's interesting. You sort of see the different theories of trauma healing, whether it's somatic, whether it's EMDR, IFS, and you see the brain doing a lot. It depends on the person or the moments in the session. Like it's almost, that's what's happening naturally, and to me it's like profound, where those theories are like really like happen
Playing
in
themselves
action,
out.
and play themselves out. People will talk, people always talk in parts, and I think that's very much the IFS model, but many of these others. There's a quote from Stan Grof. He was one of the early people who did this work in. He was originally from Czechoslovakia, then moved to the United States and did a lot of research early, before LSD was made illegal. He was doing a lot of the research in different hospitals, and then he was working. He then ultimately introduced holotropic breath work. He was doing a lot of transpersonal states and what we could do. And his quote was, he said, what the telescope was to astronomy and what the microscope was to biology, he said, psychedelics are to the human mind. He said, because we're finally getting like this interesting view of the unconscious. Like we used to have to rely on dreams or on ink blots or Rorschachs, but now we're just having a person look at a screen, literally, of their own unconscious and subconscious mind, and watch that, and we can learn so much. Just and I think we
Are there
will.
people who come out like feeling humiliated or exposed after doing some of these sessions? Like they would have inhibited themselves
Yeah,
more, and
right.
now suddenly they're ashamed or embarrassed and don't want to come back, or angry.
Yeah, interesting question. So yeah, it doesn't come. We don't find people, the disinhibition is not where people just talk where they didn't want to talk, or share what they didn't want to share. That's usually not what happens. People are still very. It's not like you're unfiltered. There's a weird paradoxical experience where, like, if in the middle of a psychedelic session, I said to the person, "Oh, how are you doing?" Like, you can say, "Oh, I'm doing okay. I'm doing fine. Do you need the restroom now?" They'll be like, "No, I'm fine," or, "Yeah, actually, I can." Like they can answer, and then they can go back in to that
Yeah.
state. So we don't find that there's like this unfiltered. People are afraid that they'll lose control because it's a new experience, but once they've done it already and learned the medicine, it's not really how
Yeah.
it plays out.
I found the first
Yeah,
session, treatment that I had, a fusion that I had, was quite scary, just in the sense that you feel like you're leaving the world, and at the same time you're co-conscious. So I know that I have a family to take care of, and I know that I have responsibilities, and at the same time it feels like I'm sort of uh, transcending this world, if that makes sense
yeah,
to those
yeah,
of you who experience that. And it's like, should I cure or should I not cure?
yeah,
I have to be here because I know I have to, but on the other hand, this feels really good, and maybe I'm supposed to be here. And that, there was something very scary about that, while at the same time very calming. It was a very
yeah,
paradoxical,
yeah,
confusing
yeah,
experience.
yeah. Yeah, there's this death rehearsal that you're referring to, where because when the ego dissolves, there's a feeling that because we only know ourselves and the world from that place, and that's crumbling, and therefore there's this death experience, like I'm going into non-existence, and I think that what ends up being therapeutically potentially very powerful is going through that experience. Like, one of the things we'll say is that when you approach something scary or dark, approach it and stay with it. And what you'll find is that it will open up. And that's so symbolic because we talk about that, to our clients all the time. Okay, sometimes we have to confront things that we're uncomfortable with, but it's really experiencing that on such a profound existential level. And for many people, that itself helps with certain anxieties, like, oh, I already, I went through death. Yeah, like, oh, I can handle, my mother-in-law for Bezak, like that. It's okay, right? So it's
but I remember being mindful, in the moment, although I know that I can't remember a lot of the parts of the trip, and I knew at the time that I wouldn't be able to remember those parts. But there were some points where I said, I'm pretty good with pain tolerance, but I can imagine that many people would not be able to tolerate this, and they would start thrashing or screaming or panicking. It was pretty, it did really feel pretty real.
Yeah.
And like there was no turning back.
Moments. Yeah, you're right. And we've had experiences. That's why we really need to have a connection with the therapists that we're working with. So it's not something we want someone to do at home or do alone. And when we've had people who there was dread during a certain period of the session where I'll go back. There was one woman who just started to scream that she was endlessly falling and endlessly dying, and she was falling into like the netherworld and die. And then we were saying, okay, we're here with you. It's okay to fall and keep on falling. And then we went through that with her for 15 or 20 minutes until she had resolved. She had to work through something. And it was interesting. She had her own trauma where she hadn't had a near-death experience herself on a certain medication where Hatzal had come. So why her mind needed to work through that, is part of the mystery of how this medicine works. But it's working with this and working through this.
I want to give everyone an opportunity to raise their hands and ask questions, please. This is a first time chance to ask questions about the psychedelic experience. You can ask about the process, or you can ask about the trip itself. Binyamin, I'm not going to ask you unless you're comfortable whether you actually went through the process and experienced psychedelic treatment, or
yeah. So to get certified, all the participants had to go through a number of psychedelic psychotherapy sessions themselves. Just if you're going to be taking people on these trips, then at least the training felt that's something we have.
Yeah, I was going to ask you, do you think that that's a necessary component? Like, if we want to treat somebody who's going on a trip, must we have experienced it before, or can we be like therapists in general, where it's like, I never went through this and this issue, but I can try to be empathic and connect with your experience as best as I can?
All right. So again, the trainings that I've done, whether it was with the Ketamine training center for ketamine, and then I did the MAPS training also, that's for MDMA. So they all had the position, and I agree with it that one needs to have just transpersonal experiences, because that's so much a part of what the experience is, and for you not to have had that and to coach someone through that is
I guess it's different. When we talk about having, doing, let's say, classical psychotherapy, whatever that means to people. We're working pretty much with emotions and feelings. And so if I've never experienced what you experienced, but when we talk about the emotion and, I can feel empathy for that because I've experienced that emotion, at least on my own level. When you're talking about something that's beyond what we experience in this world.
Yeah.
So then.
Yeah, but I think a better analogy would be, you see, if you were a therapist and you had never sat on the other side and never experienced any psychotherapy on your own, so you can probably do the therapy, but I think it adds a dimension where like this is what what it's felt like to be a client or a patient getting psychotherapy. So I think that even just that, like what does the process feel like that we can reassure a person and coach a person, know what's normal and what's to be expected, if we've never had any experience of anything like that, then I think it's just much more removed and theoretical and harder. I think.
Again, especially because it's not a in this world experience that one normally would experience. It's completely different than okay. Let's take a question from Razy. Go ahead.
Hi, thank you so much. This is really intriguing. So one of my questions you already touched on a little. I was gonna ask if like people panic, because I'm like panicking listening. I'm like the type of person I could see myself maybe like changing my mind and it's like too late kind of thing. I also wanted to know how long typically like do the effects last? Like how does the session work time-wise?
Yeah, sure.
Like, how does it work? Like do they finish the session, they're still under the effects, or?
Right. So two great questions. So it's interesting. I'll stick with ketamine for a minute. What's interesting about ketamine is that it itself is a calming medicine. So you're under the effect of ketamine having this trip. So often ketamine itself just relaxes the person, where you're, like Moshe was saying, having this paradoxical experience, which is so deeply therapeutic, where on one hand, there's a certain calm, a certain acceptance, not caring, being okay, being at peace with this, dissolving of the ego, death rehearsal, revisiting sometimes of traumas. So it's like, it really allows for a new association of a certain calm to then be the lens in which some of these scarier or more difficult experiences are felt. So so it doesn't have that just dread and panic alone. And then again, there's the facilitators who are really there to help each and every person through those experiences. There's a line out there. I don't know if it's true, but the way it's said is that there's no such thing as a bad trip. And that doesn't mean trips aren't difficult, and some of them aren't scary, and some of them aren't challenging. But what they mean by there's no such thing as a bad trip is that there's a lot of work to be done from what's experienced in a trip, and some of them are very scary. I've had many experiences with people with those, but there's what to be worked through, and can be worked through with it. So and then you had a second part to the question, which was how long are the effects? Ketamine is short. Usually the onset is around 20-25 minutes when we're talking about lozenges. IM or intravenous can be different. We use lozenges in the session. They usually last for approximately another hour or hour and a half. So the session is usually around a 3-hour session, 3.5-hour session, I would say, for a ketamine session.
That's
okay. So the therapist is with the client when the effects.
Two therapists are. We usually have two therapists with the client there straight for the 3 hours. So it's a very
What's the difference between using
lozenges
and using IV?
So the reason why we use lozenges is because it's very practical. There's no needles involved. What we do is that we have compounding pharmacies that will create the ketamine lozenges, and you put them under your tongue. They dissolve under the tongue. They usually take around, and there we're able to get the dosage. We usually start low in the first session. We'll add, we'll go up to 300 or 400 milligrams. So there'll be like 2-3 lozenges that dissolve under the tongue, get swished around and swallowed. And then the effects, it hits the brain just a little slower. And the effects are the same medicine.
Does it need a doctor on? Do you need a doctor in the house?
Not in the house. No, you don't need a doctor in the house. No.
Shoshana, you've been waiting with your hand raised. Please.
There we go. Okay, so just trying to clarify something. I remember researching ketamine for depression that's resistant to treatment. And one of the things that kept coming up was impact on memory. And I'm curious to know what you feel about ketamine's impact on memory long-term.
Yeah, well, we have not, I haven't seen any of those effects. Nor have
I think Dr.
come
Tepfer is
across that.
forgetting the research.
That's great. I haven't, that's not one of the facts that I've come across in any of my trainings. I'm not discounting that you have, but they've been using it. I mean, we're since the 50s. It's a really, really old medicine, around 60s actually. So it's around like 60 or something years old. Maybe in high doses for long periods of time. We're talking about like, 5-6 sessions of ketamine, and we're talking about, in an emergency room they'll use it like around 1,000 milligrams. We're getting absorbed in the body probably 75 milligrams, so we're using like 1/10 of the dosage. So we're not, so just the amounts are so minimal. I haven't, at least
So
not in our
IV
setting. Yeah.
and IV would be the same dosages?
So IV, we don't use IV. That's a whole different approach.
That's what
in
I'm
terms of how
referring
they're-
to probably.
Yeah.
I think that's,
Okay, could be. We use lozenges. That's what I'm most, and IM and intramuscular shots. Those are the two methods that we were trained in. Not the IV.
so I'm curious also why it's not as popular if it has such a potential for helping, that it's still something that I feel like we're trying to get comfortable with it.
Yeah. Well, I think that's right. I think that like anything new, I think we as a society and we even as a profession are learning it. We're getting comfortable with it. I think the protocols are very underdeveloped at this point. The research is young. It's very promising. I also think that there are people that approach it as a panacea, as like a magic pill, and it's not that. Like, I think that it's important to put that out there. I think that it will have, like any amazing modality and effective modality, it will be effective to a lot of people. I don't think it will answer all the problems of mental health and society, and it won't help every person, and it won't help all the time. Doing ketamine sessions, there are people that don't gain as much as other people. Not every session is as productive and as magical. And I think that I'll tell you, one of the hard things for me in reading and watching this entire field as it grows is that there's something misleading about the proponents of it. In their claim, I think it's like it's presented as really, the magic pill, the panacea, the answer. And I wish it was, and hopefully it will be for many people. But I think that it's not the only and perfect thing.
Well, there's no one
that's gonna
size
solve
fits all.
everything.
There's no one size fits all for any treatment, and we don't use
Right.
all modalities on every person, nor do we
Right.
give the same drugs to everybody
Right.
either.
Right.
Okay.
Exactly. Yeah.
Okay. I appreciate your
Amazing.
answer. Thank you.
Amazing. Thank you for the question. Binyamin, I'm curious, does using something like psychedelics speed up the process of therapy, or is there some kind of protocol or expectation of
Sure.
how many psychedelic treatments one would go through,
Yeah.
or could they just go
Yeah.
indefinitely till their therapy's over?
No. So for example, the MAPS protocol when it comes to MDMA and all their research. So there's generally 3 MDMA sessions that are given, 3 6-hour sessions. So we have a few prep sessions, we have integration sessions in between, but the actual sessions, there's just 3 of them. And we're seeing in 80% of the participants, there was a significant drop in PTSD. 3 sessions, that's it. So it's not an ongoing treatment. Because what happens is that the healing takes place, and then the symptoms and then they have follow-up 6 months and a year later, at least in these studies that are being done for PTSD, and there's the effects hold. So,
Is there any way that this can ever become affordable to people, to the general, the masses?
Yeah. So I think that as it gets out there, we'll learn how to do it better. It's time consuming and therapist, heavy. If we need 2 therapists for 3 hours, you can imagine just the time and the cost. One thing that we're going to start hopefully offering ourselves just in response to that is to do some group ketamine work where participants who've at least had an experience with ketamine individually and know the medicine can then sit, in our training, for example, we did it in group. And group meant that we had, I'm trying to remember, around 15 or 20 people who were taking the medicine, and then 15 or 20 people that were sitting. We were all in one large area, and then we switched roles the next day. So, and there was something very, very powerful about this. So people have to be comfortable with group work, but that's another setting where the cost will be able to come down.
Imagine having your ketamine infusion in the presence of 20 therapists. Wow, that's very powerful.
Well, each person, it was one-on-one because each person was lying and had we call a sitter and someone who was lying with the medicine, but they were all next to that they were in these sort of pairs, but in the group. And and at Arbor, where we do a lot of the trauma work, the Arbor Intensive Program in Brooklyn. So that's something we do a lot of ketamine work there, ketamine psychotherapy. We would like to also do the group work as we start trying to get it more efficient and affordable. Yeah.
Okay, let's take a question from Nancy. Thanks for joining again, Nancy.
Thank you so much. This is so fascinating. Hi, Binyamin. So nice to see you.
Nancy is already, the next world. Look at that.
I know, I'm trying to because I'm so fast paced, and just your voice is so soothing. One, what's the cost? 2, is there a downside? And what was the training that you had to go through, or 2? Thank you.
Yeah, sure. So great to see you, Nancy. Number 1, the cost. So in different centers and different places, there's different costs. So often therapists will charge for the time that those sessions that it takes to. So it's generally like a 3-session experience. So that'll often be the cost of that ketamine session. There are a couple of centers that are doing not just infusions, but psychedelic assisted psychotherapy. I'll name a few. There's a place, what's it called again? Field Trip, I think is the name of it. They have a location.
Very cute.
There's Field Trip. Then there's Nushama, I think is the name of another one. These are a couple of names. Again, I can't personally recommend any of them. I'm just to people to look into. So those centers have different pricing and different packages where you'll have sign up for a preparation session and then a few treatment sessions with integration after. So yeah.
Does this trigger relapse for someone who has a history of substance abuse?
Yeah, so that's a good question. So we've had people who've abused ketamine. I'm very hesitant, or not. I'm reluctant to offer them the ketamine assisted psychotherapy. But I've had people who have had other addictions. The medicines the psychedelic medicines are not really the highly addictive substances at all, especially the classic psychedelics. They're not like, for example, in all the MDMA research, they've tried to see, hey, have people who've done the MDMA sessions, have any of them become addicted? And the percentages were no higher than people who didn't do the study, would be using MDMA a year later. So I'm not seeing addiction regarding that. You asked another question.
Downside,
the
and
downside.
training.
Yeah. The downside of ketamine assisted. The downside of it. Well, I think that there's a cost. I think it's costly. So there is that. In terms of if it's done well and responsibly, I think like any good therapy, is there a downside if it's done safe? I think that the
Or
results
more
will
like any
vary.
harm potential, any potential for harm, perhaps.
Yeah. So the potential for harm is, can you have a bad trip where you're re-traumatized? And I don't think the risks are higher in psychedelics and psychotherapy than in any therapy. If it's done well and responsibly, we're not seeing more harm happen in these sessions than in others. The training. So ketamine, there are a bunch of different places now offering ketamine assisted psychotherapy training. I went to Phil Wolfson at the Ketamine Training Center. He does them in the East Coast and West Coast. He's one of the pioneers. He's been doing ketamine work since the last, I would say, 40 or 50 years. So he's really experienced, but there are a bunch of other places I don't know personally. And then MAPS. That's the Multidisciplinary Association for Psychedelic something. What is the S? I forgot. But they're doing trainings now. They're doing for MDMA.
But I mean, is it a month training, a year training?
They're training. So it's 100 hours. They're training. They have it's quite long. You go there's some online parts to it, in-person parts to it. So that's the ketamine training was, I would say, a week long, if I remember correctly, but people, they divide it up in different ways. Yeah. Okay.
Thank you so much.
Yeah, sure. Okay, great.
Okay, can we take another question from Michael and then see if we have a couple minutes to talk about maybe some other outside ketamine, see if you can share about that. Michael, go ahead.
Oh, hi, how are you? How are you, Binyamin? Enjoying this very much.
Hey, thanks, Michael. Okay.
So I am actually one of the owners of the aforementioned Ryu ketamine treatments that
okay.
And I come at this from a psychedelic experience, as well as many years of mindfulness training. So I come at it from a bit of a different angle. And one of the experiences, or many of the experiences of mindfulness training are similar to this, sort of in fast forward when you're in psychedelics. And there's a component of the mind getting still, as the DMN that you mentioned, the full mode network, quiets down, where there's an initial phase of a bubbling up of deep psychological material that's kind of been locked in there. And the experiences of a releasing and a nodding of different experiences without even necessarily knowing what they all are. There's just a general feeling of ease that takes place and that doesn't, recede. We're seeing that, a great deal on IV ketamine. And the question I have is, do you see a additional benefit to having higher dose psychedelics where there's a release of this, deep content, which then, after that, in that initial tranquility that happens after ketamine, and then subsequent to that, doing things like psychedelic assisted psychotherapy to pick up the pieces of sort of what hasn't been vacuumed up by that, initial, dedicated thing.
Yeah. So I want to make sure I understand the question. The question is there benefit to doing the higher level of medicine and then getting material to bubble up and then having the ability to then process that in a therapy? Is that what?
But more so than that is that which is, some things have been auto processed.
Okay, you got a little frozen there, but yeah.
So, can you hear me now? Sorry about that.
Yeah, go ahead, Michael. Here.
Yes, sorry. So things that have been processed on their own no longer have to be dealt with, and sort of delve into in a psychedelic assisted therapy session, delve into what's remaining and just sort of clear out, the big chunks that come out on their own.
Yeah. And I think you're touching on, not all some of the material is, like you said, like almost self-resolved. It's like, we were talking about before, this innate healing that takes place with a lot of the material. But then and I think I'll segue into, like, there's this integration piece that's so crucial with all psychedelic assisted psychotherapy, where how do we get, whether it's insights or whether it's associations or experiences, to stick and to make changes in life, and so the integration piece, whether it's
that's absolutely important.
The integration piece is so important to follow up, and then you know, just there are certain daily practices that we'd recommend. Let's say we had a certain experience in a psychedelic session, a profound realization or an experience. Can that be revisited daily or made part of a person's ongoing life to really be part of the changes? And that's part of that integration that we want to be there. Yeah, so I hope some of the question was answered.
Would there be an advantage to processing that? Two questions really. Would there be an advantage to processing that in a psychedelic assisted therapy session versus just a plain integration post session? Question A, and question B, is there an advantage to processing that immediately?
Right. So what we see is that we give some time when the person's coming off the medicine to talk. We encourage the person the rest of that day, journal, draw, take some time, because the rest of that day there's sort of a glow. The next day we'll have an integration session. A lot of times things are remembered the next day that aren't even remembered right after the session. So there's some integrating that takes place towards the end of the session, the day after, and then the dreams those next few days. There's still healing and change going on, those next few days after the session. So there's still we call it like a ketamine afterglow that hovers for some people for that next little while. So there's integration that's taking place towards the end of the session as well as the next day, and then we encourage the person to be journaling, especially those that short while after we'll do a ketamine session until we do the next one. Sometimes it can be as short as 3-4 days later, but generally it's a week or two later.
I like to call that the malleable post-ketamine mind.
Yeah, exactly.
Nature to it.
Yeah.
Thank you.
Wow. Okay, now can we jump away from ketamine for a minute? I've heard that there's some of the other psychedelics can be even more profound or more powerful. What can you tell me about MDMA or some of the others?
Yeah, so MDMA is a really interesting medicine that's really at the forefront of all the other medicines. It's not a classic psychedelic in terms of it doesn't have that hallucinogenic otherworldly. It can have aspects, but that's not its main thing. The main thing we talk about is it's a heart-opening medicine, like I told you previously, which means that the MDMA session is longer. The medicine takes, it's usually, it peaks after an hour, but it stays in the system 4 to 6 hours. So it's a much longer session. And then during an MDMA session, the content is much more autobiographical. Ketamine can have much more of an otherworldly experience. It can have shapes and it can have, non-duality with nature. MDMA for most people is much more going back to just life and to stories and to experiences, but it's done with a profound empathy. So there's generally a lot of connectivity in an MDMA session towards the therapist and towards self. So therefore, individuals will go back to content and will suddenly feel deeply for the people that helped them, for even the perpetrators that did things towards them, and then mainly for themselves. Because a big piece of trauma, for whatever reason, whether it gives us a sense of control or whether it gives us a sense of agency, is if I feel blame towards self, at least it's better than feeling powerless. That can be one of the reasons why I'll be very self-critical if a trauma happened to me. And what MDMA allows is for a profound self-acceptance relating to the traumas that have taken place.
So this sounds like a completely different experience. It's not the trip. It's not the trip.
No, it's
more
much
just
more
a deep sense of empathy, of compassion.
Exactly. So what's being, the emotion parts of the brain, the amygdala, the hippocampus are being activated. There's a lot of oxytocin that's being flooded in the system. So it hits on very different neurochemicals in the brain, MDMA. And that's why I would say we're going to see as psychedelics get researched more, MDMA seems to be the one that's lining up the best with PTSD. And that's where the research with veterans and with just sexual assault survivors and trauma survivors are the results are astounding in terms of again what MAPS is seeing in their phase 3 studies. And they're probably they want to say around a year or two away from it being legalized to actually start being used out there. So that's with and if people want to really get
you
a
say
sense,
like in 2 years we'll see a decrease in the use of MDMA because it's legal now.
yeah, I something like that. But if you want to get a real taste, I think the best way is people who have access to it's on Vimeo. It's called Trip of Compassion. It's actually done in Israel with there's English subtitles. You really get the footage of the sessions, and it's there's
Yeah, you can get it right here on Vimeo. Is this it?
Trip of Compassion. That's it. Yeah, well worth the
Trip.
and then the trip. And then just to learn a little bit more about it, they just put out on Netflix 4-part documentary from Michael Pollan, How to Change Your Mind. I see it has 4 episodes. One's on, I think, LSD, one's on MDMA, one's on mescaline, one's on psilocybin. So and he really goes through the 4 medicines and the power that they can for psychotherapy. That's a nice resource. Yeah.
These psychedelics, the more you talk about them, they sound to me like such a great opportunity for something like an IOP, where you can really be very involved with the patient on a very regular basis, keep it ongoing, keep the momentum going. Would that make sense for an IOP? Or
Yeah, so again, at Arbor in Brooklyn we have the IOP setting, and with people who are there for intensive trauma work while they're by us for the 12 weeks, and we're using ketamine often there, and just they're able to then come to group and come to after this profound experience, and then do artwork, or then do yoga work, or then do IFS work or family therapy work, and it shakes things up and opens things up for people who've been blocked or locked for so long. It facilitates breakthroughs for many.
Mm-hmm.
Yeah.
Psilocybin. Is this different than MDMA?
Yeah.
What is that?
Yeah. So psilocybin is magic mushroom. That's the original natural form. Psilocybin is the lab created version of it, and where that seems to be lining up. In Johns Hopkins did their famous study where they took cancer patients who were terminally ill, a lot of them struggling with depression, and after giving them one psilocybin session, they saw a dramatic decrease in the depression and the hopelessness of these terminally ill patients. And the reason was because they had a profound, I would call it like just a religious experience, most of them. So psilocybin is very much a hallucinogenic, where most of I'm watching the interview of an atheist for her whole life, had this profound psilocybin experience where she met her creator, and these profound experiences, upon the return, they don't see themselves, and they don't see their disease, and they don't see their mortality in the same way. You're touching something, like you were saying, beyond death. And even though this is what we believe, like, of course, there's a soul, but it's an actual experience that these people have. And then when they come back, they say, they look at their own mortality different, because they've had this experience where they left that limited self and body and went to that expansive place, and then they use their time that's left in such a different way. So that psilocybin is profound for that. It's being used for anxiety, for OCD, just to change those patterns that we were talking about before, in terms of just a rigid predictableness and allowing there to be new associations. That's where I would say psilocybin seems to be lining up. Yeah.
Wow, fascinating. Okay, any last questions or comments or thoughts for Dr. Binyomin Tepfer before we wrap up tonight's show?
This was great. Thank you so much.
I found this to be so fascinating, and I don't know how much opportunity people have to actually try this and experience it, but I'm hoping to be able to get more involved in this world. We've touched on moving forward a little bit. I've had some of my own personal experience, as well as psychotherapeutic, professional experience in working with people under the needle. And I just find it to be such a fascinating concept. Hamadina, go ahead.
Thank you. Thank you. This really is fascinating.
And good to have you back. Haven't seen you in a long time.
Yeah, I know, it's been a while. I was really fascinated by this topic, I have to say. I'm not as familiar with the psychedelics. Could you talk a little about ayahuasca? What's the difference between that and others? And I know you touched on mention of someone when you're dealing with addiction. If you can talk a little more to that around this, because there are a lot of people talking about it. And then people, I know you've done trainings on 12-step recovery, people who are involved in that world who are concerned about that if they have addiction to, let's say, a different thing, like maybe not to drugs, maybe to alcohol, or if it's to a behavioral addiction.
Yeah.
Just talk a little about that for those people.
Yeah, sure. So I'm gonna put ayahuasca on the side, only because I think that I'm more familiar and trained and have worked with the others, and so I'm gonna leave that for people who are probably more proficient in it than I am. So I'm gonna hold off on commenting on ayahuasca in terms of addiction. So we're actually using psychedelics in cases of addiction. Just a little historical note. So if you read the history of AA, Bill W. wrote the big book, and one of the experiences that he had this like profound God experience that very much led him to develop the 12 steps, which is all about that addiction is a spiritual disease. And what we now understand was there was this treatment called the Belladonna treatment that was taking place in the 50s in the hospitals. And Bill W. received the Belladonna treatment, which had psychedelic medicines in that. And that was very likely the profound religious experience that he had that ultimately led to the starting of AA. And that was the beginning of his recovery. There was actually a back and forth, Bill W. and Carl Jung, if psychedelics should be included in the AA approach, and it was ultimately not included. So these profound experiences are, to say, not the thing that's going to lead to either addiction, but very often it's the opposite. It's seeing oneself and life in a fresh, more profound way, and then people will come back and just not have that same, whether it's dependency or whether it's reliance upon these substances, because they've had this just otherworldly, profound experience that was so life-changing that they don't need that as much. There's a lot more to say on that, but it isn't necessarily going to be addiction causing. The opposite. We're seeing that it's a big part of people's recovery. Okay.
So can I just add to, so then if somebody does use this treatment, how many times do they use this? Is this something that then pulls them to need it like on a continuous basis?
Right. Right. So I can speak. So MDMA, the protocol, generally there are 3 MDMA sessions. Ketamine, people will generally do 5 or 6 at most. We're talking about psychedelic assisted psychotherapy sessions revolving it. Usually we'll do even shorter. We'll do around 3 or 4 of them. They're spaced usually 3 to 4 weeks. We don't see that there's a dependency on them. And these are not, they don't have that physical addictive quality to it. These medicines, it's not like, the heroines and the cocaines. That's not how these medicines react with the body.
Okay, Tapka Hyman, go ahead.
Hi, yeah, thank you so much. This has been wonderful. I have a misunderstanding because you said that the ketamine is the only legal one at this time. So I'm trying to figure out how and do you administer these MDMA and the other categories in your office?
No, MDMA and psilocybin cannot be administered legally yet until the FDA allows that, which they think is a year or 2 away. MDMA and psilocybin are not legal yet.
So then
only ketamine is.
Just like other experiences you've had.
So what did you say?
Binyamin said earlier that the MDMA and the psilocybin are used in trials. The experiences are from trials, and of course they're being used illegally by some people. But
Right. And there's a lot of research going on with it as well. There are thousands of people in research studies, but they're not legal to actually administer yet.
Okay, got it. Thank you.
Yeah.
Okay. So I found this to be profoundly interesting. Binyamin, you really know the course very well. And Arbor Intensive is Binyamin's, Dr. Tepfer's center in Brooklyn. For those of you who might want to refer somebody there, you can look it up, Arbor Intensive. And thank you for sharing all this information and insight. I have a feeling it's going to provoke a lot of people to go look into it more and learn more about this process. It seems, if I'm not mistaken, that this is going to sort of become almost part of the norm of psychotherapeutic treatment. That's what the predictions are that I'm hearing? Is that right? Do you see that too?
I think that's right. I give you credit, Moshe, because the show is on the cutting edge. You have to be pretty brave to because I think it's still it's controversial and it's provocative and you may get thank yous, but you may also get someone who's gonna be like, hey, what do like you're promoting
Voodoo.
what on your show? And
I already got those emails before the show.
There you go. So
I'm hoping that those people will watch tonight's show and rethink their position. I also think that like everything, we're still in the early stages and exploration, and who knows what will come out. Some discovery or finding will come out one day that might change courses. But again, you can't know until you learn about it. So so again, thank you for coming on and sharing. And
what's Binyamin's email?
Binyamin's email.
Well, btepfer@yahoo.com is my personal, or you can get me at info@arborintensives.com.
It's intensives, right?
Yeah, intensives. Info@arborintensives.
Okay.
Did I get that right? ARBOR intensives.
Yes, arborintensives.com.
Okay. Well, good night, everybody. Did want to let you know that we do have a whole lineup of exciting presenters over the next few weeks. I'm actually like a month or 2 ahead of myself, which is unusual. But thank you for doing this for us, and hope to see you on round 3. And who knows what might come out next.
Yeah.
Okay.
I thank you. It was really
Good night,
a privilege
everybody.
and honor. Thank you all.
Bye.